I'd like to welcome you to BeMoreNews.com, the news before the news, where we uncover the truth. We're here at Total Healthcare with the Chief Medical Officer, Dr. Rama Shankar. How are you?
I'm good, thank you.
Good. Can you give us an overview of the services offered here at Total Healthcare?
Total Healthcare is a community health center in Baltimore. We have 9 locations across the city of Baltimore, and we provide comprehensive services for all age groups. We also have complementary services to primary care, such as mental health, pharmacy, dental services, HIV services, and substance abuse services.
Okay. And as we're going into the cold and flu season, what is it that people ought to know?
Well, it's the flu season, and Total Healthcare already has flu vaccines for all our patients. So they need to call the clinic and make an appointment to come in and get the flu shot. Most of the people need to get the flu shot. Folks that have chronic diseases, young kids, 6 months and older, need to get their flu vaccine. Older people need to get their flu vaccine who are over 65. Definitely need to get their flu vaccines. And some other age range groups that are high risk need to take the flu vaccines. We also offer flu mist, which is a nasal spray, to younger adults who don't have any chronic illnesses that will protect them from flu. This year, the flu vaccine protects you against both the influenza virus as well as the H1N1 virus.
Okay. And what's the difference between a cold and a flu?
The flu is a more severe version of a virus infection, which could present as a cold symptom. Now, there are many, many viruses which cause common cold, but influenza or the common flu symptoms come on more abruptly. People tend to have higher fevers and chills and muscle aches. They are more symptomatic, meaning they have some nausea, diarrhea, vomiting, so on and so forth. Either way, both whether it's a cold or a flu, the symptoms in a healthy individual last for about 1 to 2 weeks, and people tend to get better naturally, as
Okay.
long as they get enough sleep, eat nutritious food, and wash their hands.
But they're both viruses?
That's correct.
Okay. And how can a person tell the difference?
Like I said, influenza is more severe. The onset is more abrupt. The fevers are higher. Whereas a common cold, you may or may not have the fever and chills. You present with some soreness of the throat. You have a runny nose, cough, and nasal congestion. But influenza seems to be more severe in
Okay.
presentation.
And what can Total Healthcare do to help us in terms of services to help counter this cold and flu season?
If patients have symptoms of a cold, they just need to rest at home, sleep well, eat nutritious food, wash their hands. Don't go out either to work or school until their fever breaks if they have a fever. If at this time before they catch a cold or a fever, they can call the center and come over and get a flu shot.
Okay.
Now, if you don't get better in a few days and the symptoms seem to be getting worse, then they need to call the center and make an appointment to see the doctor.
Okay. I have one last question. Hand sanitizer. Is that something that helps us out in the cold flu
Yes.
season? It does?
Definitely.
Okay. Why?
Washing the hands with soap and water or even hand sanitizers kill the bugs in your hands, whether it's virus or bacteria, and keeps you clean. At least you won't get it by touching your face and nose and mouth. The cold viruses are commonly spread when someone with a cold coughs or speaks, and they have their respiratory secretions that actually travel through the air, settle on your nose or mouth or your hands. Sometimes they remain on tabletops and door handles. So when people touch these things or are near people who have the actual cold, they tend to get the infection.
Okay, so what can we do in our environment? Does bleach help counter it? Lysol? Or how do we kill germs like around our desk, for instance?
It's better to wipe it clean, either with Lysol, bleach, all of them. All of these measures help.
Okay.
We don't need to overdo them, but we need to keep ourselves and our environment very clean.
Good deal. Any final thoughts, Dr. Shankar?
No, just stay safe during the flu season and come and take the flu shot because it does protect you against both the influenza as well as the H1N1 virus this season.
Good deal. Thank you so much for your time. Chief Medical Officer for Total Healthcare, Dr. Rama Shankar.
Thank you.
Keep watching BeMoreNews.com, the news before the news, where we uncover the truth.